My immediate thoughts when I look at the pictures in the paper of Kellie, having had her surgery and the complications, are first of all of empathy towards her and the situation she was in due to what appears to be quite a serious complication, and concern and hope that all is gone well. And judging by the picture accompanying the one showing her swelling and her bleeding, is one where she's looking a lot better, I presume taken around 2 to 3 weeks after her surgery, where she is looking a lot better. So I hope that now all is well and she's on the road to recovery.
She appears to have suffered, and in the article it discusses quite serious bleeding afterwards. Is that your assessment when you're looking at it? Can you see the signs of that?
Absolutely. When I look at the picture, she has some of the classic hallmarks of someone who's bled after a procedure. She's very swollen. She's got a big swelling in her neck, swelling around her eyes and lips, and she's got what is termed a hematoma, which is a collection of blood under the skin by the looks of things, as well as evidence of bleeding out of the wounds, particularly around her eyes.
As well as looking dreadful and really unpleasant, would that have been very painful?
It's interesting because pain is not necessarily one of the signs associated, but what concerns me reading the article and knowing the implications of this are the issues that could have occurred to her breathing and her airway, because when there is bleeding, especially in the lower face and neck, and it causes pressure internally on the voice box and the windpipe, that can be life-threatening if not treated and intervened in early.
This raises lots of questions. I think the first one is that cosmetic surgery is not to be taken lightly. She's alive and well, but from what you were just saying, something like this could, in other circumstances, and perhaps has in other circumstances, been life-threatening.
I think any form of surgery, and cosmetic surgery is certainly included, carries risk. And what is incredibly important is safety. Safety has to come first, and any risk factors have to be minimised, because when complications occur, some can be serious, such as in this case, and they can be life-threatening if not recognised, not intervened in, and if left alone.
When you read the article, it becomes apparent that this surgery wasn't done in this country. It was done in a European country, not very far, which actually has a strong reputation in the field of cosmetic surgery. But it does raise the issue of cosmetic surgery tourism, doesn't it? And as a British surgeon, do you have concerns about people going abroad for treatment?
The article states the surgery was done in Belgium, which is a renowned centre for plastic surgery. However, the principle of going abroad is one that concerns me for several reasons. It concerns me because of the research that one can do into the safety and reputation of a facility and the surgeon abroad, which is going to be harder to find out about than the equivalent research on someone over here in a facility. It concerns me about the aftercare and how that can be arranged for a big operation like this. And reading about it, this was around 7 hours of surgery. There is an intensive post-operative course and aftercare that is normally maintained, and how one would get back for follow-up appointments on a frequent basis if one has to go abroad each time is something that I think many people going abroad would find difficult to manage.
Just talk us through. Look at the image of Kellie on the front page, or the one you've got there, and talk me through what you can see has been done to her face.
Well, working from the top down, she's had her upper eyelids lifted. She's also had her lower lids done, which would be effective eye bag removal and rejuvenation there. She's had a rhinoplasty or nose job. She's also had enhancement of her cheeks, perhaps by fat grafting. That's taking fat from one part of the body and inserting it into her cheeks. She's also had her lower face and neck lifted to reduce the sagging tissues and skin in that area and try and enhance and improve the shape of the jawline. It's
quite a lot for somebody, and it's mentioned in the article, who has underlying health problems. Now, to what extent is that an issue here when you look at, she describes herself as seeing herself, I was grotesquely swollen, I was black and blue, I had become a monster like Frankenstein's. It's very emotive language. But I'm just curious about somebody who had an underlying health issues, was taking some form of medication. How dangerous is it to go embark on cosmetic surgery if you have underlying health problems?
Well, it comes back to the safety aspect and minimising risk. And what jumps out at me from the article is the paragraph that says doctors now believe aspirin tablets taken to thin her blood following a previous heart attack. So if someone has had a heart attack, that puts them at risk for surgery in general, especially lengthy surgery. Someone on aspirin is a drug designed to thin the blood to minimise future heart attacks, but of course that has big implications for bleeding in any subsequent surgery. And something I can't comment on is whether or not there was any modification, for example, of her medication prior to surgery to balance that risk.
But what you can tell us is what you might do in a similar situation. So what would be good practice?
In my practice, a patient who is on aspirin for a heart condition is seeking cosmetic surgery, the first thing I do is contact their cardiologist or the specialist looking after them from a heart point of view and have a correspondence or discussion with them about the safety of ideally stopping their aspirin, or if not, if they have to be on aspirin to minimise the risk of any further cardiac event or heart attack, then I have a serious conversation with the patient about whether or not we should actually be embarking on anything. And personally, I'm very reluctant. In fact, I could say I've never operated on someone who has maintained their aspirin for a cosmetic surgery procedure because of my concern about bleeding.
Do you often say to somebody, I'm not going to do this procedure, whatever the procedure is? Is that part of a responsible cosmetic surgeon's job to say, somebody else might do this for you, but I'm not going to?
Absolutely. Sadly, if people look hard enough, they inevitably will find someone who will do something. But I think it's beholden to me as a consultant plastic surgeon to have an honest discussion with anyone I see. And if I feel that I don't agree that the procedure that they desire is the right thing for them or will achieve the results they want or their expectations can't be met, then I do certainly discuss with them not having it. And recently, for example, a patient came to see me about her nose. I could just about see the issues she had with her nose. I certainly didn't feel that going through a whole rhinoplasty operation justified what might be an incremental difference in her nose, and I talked her out of having the surgery, which I'm pleased to say the consultation went very well. She understood my rationale and agreed with it, and we parted friends.
Yes. I mean, you want to leave on good terms, whether or not you're operating on somebody or not in the end. What's Kellie's future? What's her face going to end up like? Looking at it now, will she heal well? Will she get the results she wants, having gone through a really frightening experience?
I certainly hope so, and it's encouraging to see the after picture that has been published in the newspaper, where she does have an improved jawline. The swelling has resolved to a great extent. There's a little bit of bruising.
She's still hiding her eyes behind dark glasses.
She's still hiding her eyes. And what we can't see are the scars which will be around the sideburn area in front of the ears and possibly behind the ears as well. So as long as they heal well, I hope that everything will be well in the end.